Optadam is a three-dimensional rubber dam used for absolute isolation to control the spread of infectious disease and aerosols in the practice. It features high flexibility and elasticity in all directions, provides patient comfort, and assists in keeping the patient's mouth open. Select the suitable size of Optadam before the treatment. The rubber dam punch is used to make the appropriate holes depending on the teeth to be exposed. Optadam has markings on its surface to facilitate the perforation. An additional fixation of Optadam with clamps is recommended for the posterior region. A clamp attached to Optadam prior to insertion facilitates subsequent fixation in the mouth. To ease placement, grasp the flexible intraoral ring by reaching through the outer ring. Hold the intraoral ring between the thumb and middle finger and press it together slightly. Compress the inner ring so that wings form on both sides. Place Optadam first in one corner of the mouth and then in the opposite one. Subsequently, position the dam behind the lower and upper lips. Having the patient close his or her mouth aids placement of the dam. In order to place the rubber dam correctly with the clamp, hold the clamp forceps with one hand and the dam with the other. Open the jaws of the clamp and pass over the tooth, only to let go once the jaws are at the level of the cervical third. Before the dam is removed, cut each septum carefully. Using a paper towel, grasp the outer ring in the lower area and lift it slightly so that the intraoral ring is loosened from the lower gingivobuccal fold. The intraoral ring can then be easily removed from the upper gingivobuccal fold and hygienically disposed of with the paper towel. Optadam can also be used for the anterior region without clamps. The individually punched holes ensure that the dam is optimally stretched for proper tooth isolation. Secure Optadam cervically and pull it towards the oral aspect. Proceed from mesial to distal and use dental floss to overcome the contact point. If necessary, tuck Optadam into the gingival sulcus. By applying ligatures of dental floss, the rubber dam is pulled towards the gum line and fixed, which is important for proper isolation of cervical area. After the treatment, the ligatures can easily be cut and removed. Then cut each septum carefully and remove the rubber dam. Optadam. Safety and protection for patients, dentists, and dental team members.